Council Chair, or as we call it, the PAC. And on behalf of our council members, we're very happy that you could join us. I first want to get started by introducing Disability Rights Wisconsin Executive Director, who's going to share some brief remarks. Leah, you want to take it away?
Hi, everybody, and thank you for joining us. I just want to give just a little bit about who we are. Disability Rights Wisconsin is Wisconsin's protection and advocacy system, and every state has a protection, every state and territory has a protection and advocacy system. We have a federal mandate to protect the rights of people with disabilities, and as I said, every state and territory has one. So we have specific things that we're supposed to do. We're funded by 8 federal grants to do that work. And we are supposed to make sure that people don't suffer from abuse and neglect in facilities. We're supposed to protect individual rights under federal and state law. We're supposed to make sure that people aren't being discriminated against and that they can receive the services that they desire in the most integrated setting that's possible, and that they receive a free and appropriate public education, that they have access to health and safety, and that they can exercise their right to vote. And with all those things that we're mandated to do, we have limited amount of funds and capacity to do them, because as you can imagine, there is plenty of need, both on an individual basis and systemically. And one of the areas that we are mandated and want to focus on is mental health and mental illness. And so our program that is funded for mental illness is called the Protection and Advocacy for Individuals with Mental Illness. And that's what we're here to talk about today, is gathering your thoughts about what is important for Disability Rights Wisconsin to focus on regarding mental illness and mental health. We cover the whole state. We have offices in Madison, Milwaukee, Rice Lake, and we have a couple satellite offices in Menasha and Green Bay. And we started in 1977. So we also have programs in addition to our protection and advocacy system. But today we're talking about the advocacy system, the protection and advocacy system. So I'm not going to get into detail with that because my time is very limited, and we want to leave time to hear from you more than you want to hear from me. So I sign off now, and thank you so much for coming. I'm really eager to hear what you have to say.
Thanks so much, Leah. We appreciate you being here. So Disability Rights of Wisconsin Protection and Advocacy for Individuals with Mental Illness, or PAIMI, P-A-I-M-I program, provides advocacy and assistance, as Leah was talking about, to protect the human and civil rights of children and adults with serious mental health conditions. This work is provided by our PAIMI Council, and then we advise Disability Rights Wisconsin's staff and board of directors on policies and issues that affect people with mental illness, and then set priorities for the protection and advocacy program. So the purpose of this virtual listening session is for you to learn more about Disability Rights Wisconsin's mental health advocacy assistance for youth with special education needs or youth in the justice system. We also want to hear from you about the support and resources most needed for people with mental health needs, and get your suggestions on those priorities for Disability Rights Wisconsin's mental health advocacy. So we're going to be recording the session, sharing it on our website, so it's available for everyone who couldn't attend tonight. So in our meeting, we're going to have, we have an agenda included, and there's a link in the chat. And I'm going to read some of the meeting kind of ground rules. We want you to remain muted during the presentation. If you have questions for our speakers, go ahead and put them in the chat. We're going to answer as many questions as we can and share all the questions with our speaker. For agenda item, let's see, we're going to, is that number 4, Barbara? Agenda item 4? Are we going to call on people? Raise your hands. This is an option under the reactions icon. So if you look at the bottom where it says reactions, you can simply raise your hand. If you have connectivity issues, it can help to turn off your camera. This training is live captioned. So to use the captioning, you can turn it on and off where the CC is on the bottom where it says live transcript. Click view full transcript to see the captioning in the right panel. If you need support, put any questions you have in the chat and we'll be happy to help you. So the first part of our program is sharing information with you about Disability Rights Wisconsin advocacy assistance. So I'm going to turn it over to Disability Rights Wisconsin lead advocacy specialist, Phyllis Greenberger. I'm so happy to have her. I was so excited that she was going to do this tonight. So education is one of my areas that I love to work with. So a reminder to put your questions in the chat, and we're going to ask a few of Phyllis once she gets done speaking. I believe Phyllis also has a PowerPoint we'll be able to share.
I have a PowerPoint and Jeannie said she would share it for me. Are we ready?
Awesome. Yeah, and it's also available on the DRW website post about this event also.
Yes.
So go ahead, Phyllis. We're excited
there we go.
to hear from you.
There it is.
Yay.
I assume everybody can see it because I can. So I'm sorry, my head is going to go back and forth. I have a second screen that has some of my notes in. So just excuse that for a second. So I'm Phyllis Greenberger. I'm a lead advocate at Disability Rights Wisconsin, focusing on all things children, pretty much is where I spend my energy. So I do special education advocacy, some children's mental health, and some advocacy in the youth justice system. So what I'm going to talk about today is the education and youth justice advocacy. I'm going to go real quick through a couple of things that we do for individual cases, some systems issues, and then take questions. So bear with me. I'm going to do this pretty quickly so that I can't cover everything that we do. I just picked some highlights. So Jeannie, next slide, please. This is fun. So hi to everybody. Some of you I know, some of you I don't, but hi and thanks for coming. First of all, I'm going to talk a little bit about our educational advocacy and the individual kinds of situations that or cases that we might get involved in. So first of all, even when we aren't able to get directly involved, go to a meeting, do a mediation with a parent, etc., we do provide parents information on what their rights are under special education law. We help parents strategize about an upcoming IEP or individual education plan meeting, help with strategies for developing that, what services they might include. We do a lot of strategizing with people on both what the rights are, but also what strategies might get them what they're looking for. We also do get involved more directly in individual cases where there's been some school exclusion. And we think of school exclusion kind of broadly. So shortened days. We've had calls about students who are going to school a couple hours, 3 days a week. Not getting a full education. So we frequently, in that case, do actually get directly involved and go to an individual education plan or IEP meeting with parents. We also think of suspension and expulsion are areas that we often talk to parents about, especially if the suspensions are directly related, for example, to the mental health issue. This applies to not just PAIMI, but in this case, individuals with mental health issues tend to get more of the shortened day and suspension and expulsion issues. We also take individual cases and go with parents to meetings regarding restraint or seclusion in schools. Next slide, please. Thank you. We also, so this is something that comes up a lot for kids with mental health issues. They often, in school, there isn't a eligibility category called mental health or mental illness. There are more than one category that might apply. One is emotional or behavioral disability. So sometimes part of the special education law is that if the child's behavior is impacting their ability to learn or others' ability to learn, you have to do what's called a functional behavior assessment, FBA, or functional behavior assessment, and then develop a positive behavior intervention plan. And so sometimes we get involved to go to meetings and help people develop a positive behavior intervention plan. For example, we've gotten calls like the behavior plan is tell the kid to stop, call the principal, call the parent, call the police. That's not a positive behavior intervention plan. And a variety of things sort of in that direction. So we might go with parents to help develop a positive behavior intervention plan that will keep the child in school and hopefully avoid those suspensions that we talked about in the previous slide. Sometimes individuals that we work with are not only needing special education in school, but they're getting, and I think you talked about this maybe at the last meeting, but getting services from the community, for example, some kind of wraparound services or mental health services privately or publicly through the county. And parents are kind of trying to juggle school and mental health services and sometimes the youth justice system all at the same time, and a therapist and a doctor. And so sometimes we help support communication between the family, the school, and other providers, and make sure if there is information that providers might have that could be really helpful in making plans at school, we help bridge that gap and help people communicate together and then bring that to the meeting, whether that's in writing, whether that's asking a therapist to be present either at the meeting or for part of the meeting. So those are some of the things that we do. One other thing, there's a lot of them, but I particularly wanted to mention this one because when we were talking previously about getting involved in shortened day or suspension or expulsion or any really kind of school exclusion, you'd be surprised at how many calls we get about kids who are not fully in school. If a student is up for an expulsion, you cannot expel a student. Under special education law, you cannot expel a student if that behavior is a manifestation of the student's disability. So, which is if it's a direct and substantial relationship or it caused what the behavior was, you cannot expel the student for that behavior. Or if the student had an IEP and the district wasn't following that IEP and that caused the behavior. For example, if a student is, it says in the IEP is supposed to be supervised at all times, and because of certain behavioral issues, and then they're not supervised and that behavior happens, then it's directly because they didn't follow that plan. So if it's because they didn't follow the plan directly, or if it's a direct relationship to the disability, you can't expel the student for that. So we often attend manifestation determination meetings with parents to help with that process. Next slide, please. Sorry. Okay. So I also wanted, so besides doing individual cases, most of what I was just talking about, there's definitely an overlap in terms of topics, but most of what I was talking about already is cases where we individually talk to families or parents on the phone or directly go out with a family to a meeting. We also, I mentioned IEP meetings, we also sometimes go to mediations with parents. So there's a special education mediation system in Wisconsin, and we sometimes help parents at a mediation session. Now I'm moving to things that we do in the systems area for education. So the systems I think of as public policy, things we might do with an agency. It might be working on a law or a rule, administrative rule. It might be being on a committee with a group of people. I'm on some statewide committees. So some of the things that we do in the education area is supporting school-based mental health. And so there's a couple of ways that we've done this and that people are doing this in Wisconsin right now. As a matter of fact, both of these next two things are in the governor's budget, which is now out. And so next step is hoping that the legislature will keep these things in. One of those is pupil services categorical aids. And so what I mean by that is school psychologists, school social workers, school nurses, school counselors. There's additional money to put toward those for school districts. The school districts don't get a lot of reimbursement for that. Matter of fact, what's in the budget now would only cover about 10%. And so our state is woefully low in these categories, guidance, counselors, social workers, school psychologists, and nurses, all of which obviously support students with mental health needs. So we've supported that, and they call it categorical aids. Then the other piece we've supported is school-based mental health services collaborative grants. It's kind of a mouthful. So those collaborative grants are where schools can collaborate with outside providers that can come to the school and provide mental health services. So it's like a therapy agency connecting with the school, providing services in the school. And the money that comes for these grants helps that coordination and collaboration to happen. The provider themselves is paid for either by insurance or Medicaid, but the collaboration is through those grants. And so both of those are increases, and both of those are in the current budget. The next thing another thing that we've worked on was the seclusion and restraint law. So a number of years ago, DRW worked on getting a seclusion and restraint law in schools with some other agencies, Wisconsin Family Ties and Wisconsin Facets. There might have been one other that I'm not remembering, sorry. And then a couple of years ago, we worked on getting some significant changes to that law. So after we saw it operate for a while, we noticed that it needed, there needed to be some changes, and we worked with those same agencies again on those changes. We've worked on getting trauma-sensitive school information out to different districts. DPI has some good curriculum on that. And then in the increases, we've also worked for many years on increases in special education funding. There was about 10 years where there was no increase from the state in special ed funding that goes to districts. And in the last budget, there was a little bit of increase, not nearly what districts need. And there is some funding to increase that in the governor's budget again this time. So I don't know if there are questions. Should we take quick questions on education, or should I just move on to the other stuff and take them at the end, Teresa?
Why don't we just keep going and we'll take them at the end. Phyllis.
Okay, sounds good.
Thank
Next
you.
slide, please. Okay, so now I'm going to switch my head from talking about education or school advocacy to talking about youth justice, or sometimes it's still referred to as the juvenile justice system. I've been using the word youth justice because I was on a committee where a number of young people said, we don't want to be called juveniles, we want to be called youth. So we're trying to change that in Wisconsin. So in the youth justice system, we do get calls and do some individual cases. In this area, we have focused more on the systems issues, but we do also do some individual cases. So we've had clients at detention, we've had clients at the Department of Corrections, Copper Lake and Lincoln Hills facilities, which are up in Lincoln County. Previously, there were other facilities that we would go to advocate for appropriate mental health services for individuals, to get access to those mental health services, to increase the ability to get access to those services, to think creatively and outside the box of how those mental health services could be provided. And that might include medication, it might be therapy, a variety of direct services, and also just some extra supports to support individuals with mental health needs that end up in the youth justice system. Individuals, youth with mental health needs are overrepresented in the youth justice system. If you look at different statistics, there's a little bit all over the map, but up to 70% of youth that come in contact with the justice system are youth with mental health needs. So, and you see that in the adult system as well. But so it's a big issue for youth mental health services and getting those supports. The next thing I wanted to talk about is the access to again, these are going to overlap a little bit with our systems issues, but we have gotten calls about youth who are isolated in their rooms for long periods of time. And we've done individual cases in that area, again, at detention, at Mendota Juvenile Treatment Center, at Lincoln Hills or Copper Lake. We'll get calls either sometimes from a parent who knows about this. And so we've met with the team and parent and sometimes with the youth themselves, depending on age, and tried to work out other ways of supporting them that would reduce that isolation and room confinement and restraint as well. This is an issue for youth in the justice system in general, but it's particularly an issue for youth with mental health needs. They tended to be isolated more from what we've seen, and the impact on them is quite great. And being isolated for long periods of time is really not good for their mental health. So this is an area we've worked on. And of course, the access, this is the overlap between the education and the youth justice system, but access to appropriate education while they're within the system. So we've gotten calls where a student's IEP is not being followed while they're at detention, or they're getting very little educational services or things like that. So we might get directly involved in that kind of situation. Next slide. Thank you. Sorry, I know I'm talking really fast, but I'm trying to get through it all so I can answer any questions if people have questions, and then hear from you, because that's really what we want to do tonight. So in some of these, you'll see overlapping with the individual cases. One thing that I've always felt is been really good about Disability Rights Wisconsin is that the individual cases or individual things we hear about inform our systems advocacy, and the things that we're doing systems advocacy on inform some of what we take on as individual cases. So if we see a lot of things happening over and over in an individual case, for example, that seclusion and restraint issue in schools, or in this case, we've seen a lot of isolation, room confinement, and restraints through our individual cases. So we've also then worked on it as a systems issue to reduce that systemically in the youth justice system through different committees, through working with individual places to reduce the restraint or room confinement or isolation that they use. And then when we've had some change systemically or had some law passed, we then start looking at individual cases and saying, oh, did that really do what we wanted it to do? So one informs the other. So isolation, room confinement, and restraints is a big systems issue we've been working on. Another issue, which anyone who knows me knows how I feel about this next one. Many years ago, there was a push to get tough on crime and get tough on juvenile, youth criminals. And so 17-year-olds were moved into the adult system. So you can't make many decisions at 17, but if you commit any kind of crime, you are automatically an adult in Wisconsin. And a number of states did this. I've been around long enough that I testified against it then, and I believe I was right then, and I'm still correct. And so we've been working on trying to get this change, raise the age. There's a group working again on this budget on to raise the age back to 18, where only adults are in the adult system. Another issue, and I'm not sure if you've all heard about this before, it was in the newspaper for a long time, is closing Lincoln Hills and Copper Lake. So right now, the only larger DOC or Department of Corrections facility for youth is way up in Lincoln County. Many of the kids are not from that area. The world has changed and the thinking has changed on youth and what they need. And so we are, along with lots of other people, supporting more community-based services close to home, youth at home whenever possible, when they have to be in residential or some kind of facility, to make that as close to home and as home-like as possible. So that's another area we've worked on. And I think Barbara just put this in I saw one of 3 states. Yes, we're one of 3 states now. So there were a number of states, but over the years, they've been going back in terms of the 17-year-olds, and now it's just Georgia, Texas, I believe, and Wisconsin. Maybe we'll get that changed. And then we also work on a number of committees, and I've been working with Milwaukee First on a programming committee. One with closing of Lincoln Hills and Copper Lake, the idea is for youth to be closer to home. So I worked on a programming committee for Milwaukee, and I've been working probably about a year now on maybe longer, because we actually met in person at first, so I guess it's pre-COVID, on a programming group that we had a grant and are working with a national organization on girls programming. So I think I talked really quick. You can put on the last slide if you want, which is just my name and email in case people have questions later that they don't think of right now. You're welcome to email me with any questions. I'm in our Madison office, so that's our Madison office phone number. And I'm just going to pause and see if there are some questions. I was not following the chat, so if somebody else was and wants to throw anything out there, go right ahead.
Thanks, Phyllis. Colleen, do you have the questions?
Yep, I'm watching them, and hi there, Phyllis. We have a question from Kimberly Coronado. Can you share how you support a youth in court who has a disability and their voice is not being heard or considered in the legal system?
Hi, Kimberly. We actually do not go to court frequently, and that is because youth are represented by public defenders if it's a youth. So if they're in court for so instead of a criminal in the youth system, they call it a delinquency. So if they're in court for a delinquency, they do have a public defender. So we don't represent in those proceedings, but we do work sometimes with public defenders on the disability piece of the advocacy. So they might contact us and try to get some ideas from us about other placements or what kind of programming might help. We do sometimes go to court as kind of a support person to explain the disability. We have gone to court sometimes to support. So we have gone to court regarding kids with school issues where the IEP hasn't been followed, and we may go to explain that. So those are some of the things that we do, but in the delinquency court, we don't represent kids because other people do.
And we have a question from Sarah Lukowski. Do you only oversee or get directly involved with youth in state facilities, or do you work with private disability day schools and residential facilities as well?
So no, we don't only get involved with the state facilities. We do have, for example, we sometimes get calls about patient rights violations in a private residential treatment center. We don't do in the school area. Most of our advocacy is in public schools, but most kids are in public schools, and the rights that you have under special ed law apply to public schools. But as far as some of the youth justice area, it's not just the state facilities. It's also detention centers, which are county-based. It's private residential facilities, etc. So yeah, it's broader. I hope that answers the question.
And we have another question. Are there any statistics on facilities, both private and state, that are available for the public, like staff turnover, restraints, state inspection violations, medication errors, things like that?
That's a really good question. Some of those things, the data is kept, and some the data is not kept. So so restraint data in residential centers, they do have to keep that data. It gets a little complicated because Department of Children and Families oversees the licensing of those places, but Department of Health Services oversees restraint issues. So there's, it's a little bit complicated to answer that question. So some information is kept on a statewide basis and some information is not kept.
There's a question.
So can I just say on that one, if somebody wants more, like whoever asked that question, if you want to talk about that more, it might be good to just email me and we could, you know, talk. It's hard to answer all the pieces of that today.
That sounds great. Thank you.
And then we have a question from Cindy. Can you share how your HAL, your services may change now that there is a new mental health emergency center in Milwaukee and mental health is somewhat being privatized for adults? Also, there is some issue as to what age is a youth, 17 or 18 in Wisconsin, which obviously you just touched on.
So let me answer the second part first. So for just about everything, 18 is the age of adult in Wisconsin. For school purposes, you can stay in school up to 21 if you have not graduated and you have an IEP. However, for the youth justice system and being charged as a delinquent, you're an adult at 17. Go figure. So that answers that question. I'm not sure about the question. I don't think is the center going to serve youth, Barbara? It is?
Yes. Yeah, thanks, Phyllis. This is Barbara Beckert, also with Disability Rights Wisconsin. And if someone has an additional question about the new to be Milwaukee Emergency Mental Health Center, you could feel free to follow up with me. It will serve both adults as well as youth. There will be a separate area for youth and their families. It will be in the city in a more central area than the current emergency center. And it is going to be a joint effort of the private healthcare system and the county. So the county does have a role with it, but the actual emergency mental health center is going to be administered by Aurora Healthcare. So I don't know if that answers the question that I think it was Cindy had, but if there's additional information that you're looking for, please feel free to follow up with me. And if I don't have the answer, I will help you to get it.
Another question, can you help establishing lines of communication with mental health inpatient facilities and schools, if granted, in order to help facilitate plans to re-enter the school environment?
Yes, so often hospitalizations for youth are very short, and so in those cases, sometimes that's not necessary, but yes, we do get involved in when there's longer hospital stays, if someone knows to contact us. So we're not, you know, there, as Leah said at the beginning, we have a limited pot of money and there's only a limited number of us doing some of these services. So if families do contact us and someone's been in the hospital for a while, we can both facilitate plans for re-entry to school and possibly then go to an IEP meeting to help advocate with that family. We also, this isn't today's topic, but we also sometimes will do advocacy to help get services in place upon transition out of a hospital. So both mental health services and school services.
And we have a question. How have you been serving people with disabilities that experience domestic violence?
So we do have a grant that specifically focuses on victim. It's through the VOCA, Victim of Crime Act. It's a grant through that program. And we do, through that program, we serve individuals who have disabilities who have also been a victim of crime. So we can serve individuals who have experienced domestic violence. Sometimes we go to court with them. Sometimes we advocate for services for them, help file a restraining order for them. For youth, we can serve those youth and help them sort of get things working well in their lives, which includes doing special ed advocacy for youth who either have been victims of crime either directly, so experience abuse, neglect, or other crimes, but also have been witness to domestic violence. So we do serve some youth and support their school support school services through that grant.
We also have a question here that looks like it might have been split up by a couple of different chats, and so I'm unclear on the question, but it's from Kimberly Corona, and it concerns the State School Accountability Board and the fact that Wisconsin is one of 2 states that don't have one of those. I'm wondering if Kimberly has a question, maybe she could unmute and ask it.
This is Kimberly, and I was just wondering if that was on the radar of maybe advocating for it, maybe down the line. We definitely need one in Wisconsin.
Can you tell me again what I missed what it was?
Like a state run, basically, you know how DPI runs things. It would be an accountability board, like a state school board, basically overseeing the whole state.
It has not been something that we have worked on in a systems way, but it's certainly something I would be willing to talk more about. Are there other questions?
I think that's it in the chat anyway.
Okay.
Does anybody else have any questions for Phyllis?
This is Barbara. I actually have a question for Phyllis. Phyllis, there's such important potential opportunities to make some positive changes, both for special education funding as well as for the youth justice system. And I just thought it might be helpful to just take a minute to talk about the opportunities that people have to do that. And we could send a follow-up email out too with some suggestions if people are interested in that information. Whoops.
Sorry, I was muted. You'd think after a whole year of this, I wouldn't do that, but yes, I'm chatting away and I'm muted. And I just noticed that I'm DRW host, not Phyllis G, which I'm usually Phyllis G, because I used our DRW. I was doing a different meeting earlier on Zoom, so sorry about that. So yes, there are a number of opportunities, and now is a really good time because right now, as I mentioned, the governor's budget has come out, and the next step is that the legislature puts together their budget. They might keep a lot of things, they might start over, they might keep a few things, you never know. So right now, there are some so the Joint Finance Committee is the committee that works on the budget. Eventually the whole legislature votes, but the Joint Finance Committee works on the budget. They are in the process of holding hearings. I think there's maybe 2 more in-person hearings. The virtual hearing filled up in about 20 minutes or 40 minutes or something, which is toward the end of April. There is some advocacy going around, including us supporting this to open that up further, because if you're really wanting to hear from the public, you would like to hear from more than people who got in the first 40 minutes, just my opinion. So we'll see what happens with that. But even if you don't get a chance to go to one of the budget hearings, you can contact your own legislator. So if you have a story to tell about special education and how an increased funding in special ed would be helpful, or you have a story to tell about 17-year-olds being treated as the youth that they are, or so a number of the things we talked about: special education, increased funding, the increase in money for the school mental health services, both the services for the collaborative grants, as well as the school services for, the guidance counselors, psychologists, social workers, and nurses. You can call your own legislator and support that in the budget and ask them to support that in the budget. If you live in an area that somebody is on joint finance, you might contact them and tell them what you support in the budget. The youth justice area, there's a number of things that are in the budget, including additional money to support community-based services through, there's something called youth aids, so increase in youth aids to support more community-based services and help close Lincoln Hills and Copper Lake and have kids at home or closer to home. There, the 17-year-old issue is in the budget. I didn't mention this in my talk, but there's also in the budget to raise the age from 10 to 12. So it used to be that delinquency was from 12 until you turned 18, and then they moved it to 10 when they moved the age down to 17. So 17-year-olds are adults, and to 10 to 12-year-olds can now be delinquent. So that's in the budget as well, to move the age back up to 12. So those are some of the things in the budget. Those are some of the ways, by calling your own legislator, by going and we can send out information on the couple of hearings in person that are coming up. If you are going to go in person, I recommend you get there early to get on a list. And you get 2 minutes to speak if you go to the in-person ones. If you set up a meeting with your legislator or their staff, you sometimes get longer to speak with them, 15 minutes, sometimes even longer. Does that help, Barbara?
Yeah, thanks, Phyllis. I was just going to add that one other opportunity, and I put the link in the chat, is that the Joint Finance Committee has a public comments website. So anyone is able, you don't have to sign up or go to a hearing, you can share your priorities in that way. So it's a really easy way to share your ideas for the budget, and they download those comments every day. And they keep track of how many people weigh in on different issues. So if these issues are important to you, it's a real easy way to share your concern and to give these issues more visibility.
Yeah, and just one of the reasons we've worked so hard on this issue, it's not just that I think it's important that 17-year-olds be treated as youth, but the adult system really is not equipped to provide the services that somebody who's 17-year-old needs. They're not equipped for the educational piece or the mental health supports or any of that, where the youth system is much more equipped. So those are some of the points and reasons.
Awesome. Thanks so much, Phyllis, for joining us and for enlightening us. I appreciate all the hard work that you do.
Thank you, Teresa.
Yeah, it was good seeing you again. So thanks everybody who had questions. I hope we got the questions answered. It sounds like we're looking to share an email also. Is that correct, Barbara?
I put my email on the slide, but I'll also put my email in the chat in case anybody wants to contact me directly, because I know I had to go through things pretty quick today. So I'll go ahead and put it in the chat while you go ahead.
That sounds good. Thanks so much, Phyllis. So now we're going to ask you to share your input. So our PAIMI Advisory Council has a charge to assist disability rights with identifying issues that are most important to the mental health community, and provide feedback to the disability rights staff and the board to help set the priorities for DRW's mental health advocacy assistance. So now we're going to ask you to share your input and suggestions. So since our time together is sort of short, we also want you to complete the survey if you could. The staff is going to provide a link in the chat.
Yep,
to
coming in
that
1 minute.
survey. And I really encourage you to take this survey. It kind of helps us understand where there's a need and what area there's a need, the communities where there's needs. It helps us set those priorities and what we would like to see disability rights working towards. So we also invite you to respond to these questions. And now you can just kind of I'm just going to say the questions. What supports are most important for people with mental health needs? to support the recovery and live successfully in your communities? And what are your priorities for disability rights mental health advocacy? Now, if you want to speak, you can raise your hand. There's under reactions, they have the raise your hand. We'll call on you and unmute you. So please keep the comments short so we can allow to hear from more people. So you could also go ahead and share your comments in the chat. We'll be saving the chat. Any comments responding to these questions are going to be shared with the PAC and disability rights staff and board. So what supports are most important for people with mental health needs to support in their recovery, to live successfully in the community? And what are your priorities for Disability Rights Wisconsin's mental health advocacy? Erin?
Well, I can tell you one thing that is not my priority. It's training school resource officers is effective. That it's pretty much a topical thing that they go, that after that they go back to their academy training. Stop the threat.
Thank you, Erin. Yes. Elaine? Elaine, can you unmute?
Sorry.
I know, it happens all the time.
Thank you guys for allowing me to join you today. I wanted to just tell you that something we have recently discovered is there is a huge injustice with our mental health in the criminal justice system. That's a long, broad subject. I realize that, but over 90% of people who are incarcerated, no matter what age, have a mental disability, which basically tells us right up front, we're doing something wrong. We are not advocating for the mental health sufficiently to where they are being protected in this system. I have a son who is 31 with autism. I have a master's in education. So when he was originally diagnosed at age 2, most pediatricians didn't even know what autism was. So I was grateful to at least have the experience that I did to be able to get him a lot of educational assistance. But as we've gone through life and we thought that we had been able to jump the big hurdles in life, we've come to begin a nightmare. And it's been so eye-opening to realize that our criminal justice system is so unfair to our mental disabled. And I would love to feel that we can continue to ask committees or legislators or someone specifically to help us, but I don't think that's getting it done. And I really think that as a mom, and as obviously everyone here who cares about those with mental disabilities, we are going to have to get a lot stronger in our voice. We are going to have to get an agenda that really raises this awareness in our system, because it doesn't seem to be getting any better. And I unfortunately think, as more times than not, we as moms so many times have to be the backbone for change. So that's what I wanted to add.
Thanks so much for your input, Elaine. We really appreciate it. Sarah?
I think Chelsea had her hand up first.
Oh, okay, thanks. Chelsea?
Yeah, so I just want to also kind of back up what Elaine had said about the criminal justice system. Since she already mentioned it, I'll kind of move on to then one of the other things I wanted to mention, but definitely that was something I wanted to bring up. So I have the experience of parenting a child with multiple disabilities, and I think that some things that's becoming more and more clear to me is that there isn't a strong connection to mental health and developmental disabilities, and my daughter's deaf, so also like the deaf community. I just feel like we're hitting so many barriers with access, even with the move to telecommunications, trying to get the captioning from the clinics and these providers, trying to get the sign language interpreters, all of those things. So folks that are kind of at that intersection where it's like mental health paired with another diagnosis, whatever that might be. And then also thinking at people, who may be members of like a marginalized or oppressed community. I know that I have been learning a lot more specifically like about the Hmong community and just how access is incredibly difficult for them. And then we think about, you know, the BIPOC communities and everything else. There's just a lot going on with that. And I feel like we're not doing enough to like educate our providers or ourselves about, like I said, those intersectionalities. So I'd like to see more partnerships developed. And I know that's another thing that someone else brought up, you know, about their child with autism. But yeah, sorry, that's not maybe as clear as I wanted it to be, but I'll pass it on to someone else now.
Awesome. Thanks so much for your input, Chelsea. Appreciate that. Sarah?
Okay, yeah, I second all of that. So then I'll move on to one thing that I think gets overlooked, just with all the other priorities. And I grew up in a family with my younger brother had a lot of mental issues, probably diagnosed with every single one that there is over the course of all the different therapists that my parents tried. And actually, I saw that come up in the chat as well, just knowledge, empowering parents and letting them know kind of what their choices are, having access to information, especially in more rural areas that are isolated from the cities and from some of these treatment facilities. But the one thing that I would like to mention is after all of the treatment and has been given, more training for long-term, as in maybe job skills or empowerment to go to school if that's what they would like. I worked in a private residential facility that had a school attached to it for both the residential and then for day school students. And if there could just be a way that it could be built in to really help the kids not just stabilize then in short-term treatment, but once they're back in their homes, back in their schools, long-term job treatment, so that when they finally do turn 18 and kind of have the sole control over their futures, then that they're empowered with the knowledge and the training to do that. That's all.
Thank you, Sarah. I appreciate your input. And I see we're getting a lot of comments in the chat. I appreciate those. Your input is so valuable for our committee and for setting those priorities and knowing where there's needs and where there's lack of services or where we can be of help for people in our communities. I appreciate that. Is there anyone else? Elaine? Go ahead, Elaine.
As someone who has had a child with a disability for 31 years and had the opportunity with today's technology to see how many different groups are forming that are not necessarily educationally based or even based by different organizations, I just feel that it would be so powerful if we could find a way to really all unite together because our children's voices are the ones who will never be heard. The only way any change will happen, and when I say our children, even though my son's 31, when you have a disability, you have too many aspects of your life that are still incorporated in some ways kind of as a child. I feel that if we don't all find a way to unite together and make our voice one big, strong voice, change will never happen. And I think Sarah made a great point in the fact that there are so many things that happen in the small communities away from the larger facilities where those people feel so helpless and they feel so out of the range of advocacy that it makes the struggle even harder. I think Wisconsin does a lot of things right. I think a lot of states do a lot of things right, but I don't think the true change is going to happen until somehow one way is developed to where everybody is united. And, you know, we have so many people who have a mental disability, so many people, but in so many ways they're treated, you know, with minimal importance. And I just appreciate everybody who is trying to make change, but I just would love for the efforts to be made to where there is more of a national unification for all of us to join together, because again, only us as a united voice is going to get anything changed. And the sad part is a lot of us don't even realize the deficiencies until we are in a specific situation to where we thought, you know, this wouldn't happen. And then all at once we find it does happen, and we're just completely shocked at the reality of the scenario of, you know, what is available and what's not. So.
Thank you, Elaine. I appreciate that. You know, we always talk about the silos of services, kind of the same thing. We're all kind of in our own little separate areas. So yeah, combine with one voice. Thank you. Anyone else want to share? Again, you can also post your comments in the chat on what you would like to see, or where your priorities for disability rights, mental health advocacy, where you'd like to see it go. Also, if you have any ideas or topics for other virtual events you would like to see us do, please also note those in the chat, because we'd like to get your input too on other topics that you would like to see addressed from our committee. So we can go ahead and do that. So seeing it is pretty close to, I think, 6 o'clock, I want to thank everyone for joining us. We appreciate your input. The information you provided us this evening was very helpful, which is, we're always looking for input. Again, go ahead and fill out that survey that the link is in the chat. Erin, did you have a question before we go?
No, more of a comment, really.
Sure.
I think folks should know that joint finance committees tend to be day-long affairs, and that early means like 6 a.m. early, getting in line and testifying. If you want to go on with your day, you should probably get there really, really early. So it's like, again, they tend to be all-day affairs. So
I appreciate that, Erin, and you're right. You get there early, you sign your name on the sheet, and then you go out for coffee and breakfast and sometimes lunch, and then get back. Just don't miss your number, because they'll pass you on by and you got to start over. But yeah, definitely
yeah.
Definitely.
And we have families with busy lives who need to go on with things. Yeah.
Yeah.
So.
Yeah, not exactly convenient. So again, we appreciate your input. Again, fill out the survey, and any ideas you got for upcoming topics, let us know, put it in the chat. That said, I thank you all for being here, and I appreciate all that you do. Thank you so much. Bye-bye.
Thank you, everybody, for coming.